So I wrote a blog post last week about the importance of family involvement in drug or alcohol treatment. And to promote the blog post, I did a couple social media posts, and one of them I posed a fun little sort of quip question. I said, what does Led Zeppelin have in common with drug rehab? And the answer is communication breakdown. If you're not familiar with Led Zeppelin, that's the name of one of their more popular songs. And so we're introducing the idea of a communication breakdown that occurs in drug or alcohol treatment. So I posted that on some of the social media, and I got sort of a snarky response from a colleague in the addiction treatment field who I believe he runs the family program of a very well-respected treatment program, and he's well-respected. I know he runs a really good family program, but he wanted to say that he did not agree with my position on what I was sort of saying in this post introducing my article. And my response to that would be, again, despite even the best treatment programs that have the absolute best family programs, unless the family is in treatment 24/7 along with the client, there are going to be inherent gaps between the client, the family, and the treatment team. That's the point behind all the work that I do with my Rehab Works program. I wrote a book years ago and developed a family program after running my own treatment program for over 10 years, where I learned how much help the family needs to be able to effectively support the treatment process, which means they need to understand, one, what the clients are learning in treatment, just understanding what addiction is and the implications for treatment and the implications for recovery. And they also need to know what's going on as far as the treatment plan for them to be able to provide effective support. And again, even in the best family programs, pretty much, I would say that an example of good family program, the most the treatment center can involve a family, it might be if they have the luxury of a full week of family week once a month, or, maybe they are able to, if they're in treatment longer, maybe they go to a family week, intensive family weekend, as we sort of watered this down because of time constraints and financial constraints. They just can't dedicate that much time to family involvement. So maybe a family week, maybe a weekly family therapy session, maybe in addition to that, a weekly education group for the families. That's usually the most, and a lot of you know that that's more than a lot of treatment programs provide. And so again, the bottom line is, the clients are learning a lot more in their treatment about addiction and recovery and what that looks like, implications for having a substance use disorder, than the families do. And there will be gaps in communication. My response, when I saw that, I disagree with your opinion about communication breakdowns, my response was again, I think I get where he was coming from, and he may not have been seeing it the way that I was seeing it in my short social media post. But I could have said I had just gotten out of a session when I read that response where I was talking with some parents, and they said that their son had told them, as far as his aftercare plan, that he didn't need to go to IOP. And the parents were asking, well, is it part of the recommendation? No, my counselor told me it's up to me. I don't have to go if I don't want to. Now, I know for a fact that was not true. But the problem there is the parents unless they were there in the session with the counselor who was maybe telling that client a different perspective on the view of attending IOP following his discharge from residential treatment, they were put in the position of responding to dishonesty or inaccurate information. And so the position the family is in, trying to support a loved one and even, willing to participate in everything the program offers, there's going to be scenarios like that. And the bottom line, getting put in the position of having to respond to something that's inaccurate creates an unhealthy dynamic just in and of itself. But bottom line is the client saying, counselor says I don't need to go to IOP. He said I could if I wanted to, but I don't need to. And the fact that because I talked to the counselor also, I know that that's not what the counselor said. That to me sounds like a communication breakdown. Another example, I just got out of a meeting yesterday with a treatment team where I was working with the family and the client that is in treatment there. And I brought to the treatment team's attention some very important points about we were talking about discharge planning for this client. So I brought attention to some points that the treatment team was not aware of, and they made a really big difference in terms of how they're preparing the client for discharge. And that's, again, the client might not report everything that's important for the clinical team to be aware of, or in the amount of interaction the treatment team has with the family. Again, I keep saying this, even in the best programs. I know there are a lot of treatment programs out there that have really good family programs, but it's still, they're not there all the time. It's going to be limited, and there's going to be the potential for gaps. And again, the work that I do in my Rehab Works program is I recognized that a long time ago, and I just put some effort into developing ways to deliver more information than they're just able to get from their participation at the treatment program to give them a greater chance of providing effective support. Yeah, granted, sometimes effective support means holding the client accountable if they're not completely following the plan. And drug or alcohol treatment is one case where a treatment plan is devised for the client, and lots of times the people, the supporters around the client, don't know what that plan really entails, or some of the nuances of that plan, or some of the important implications of that plan. They want to be supportive, but because of those gaps, they don't know exactly what effective support is. And I submit that's one of the biggest reasons that we see for poor outcomes is just things are able to fall through those cracks. And it's simple stuff. My work with families over the last few years that I've been developing this more has proven that just by being aware of understanding the continuum of care, yes, IOP or some form of how important outpatient counseling is, continuing an outpatient care after a residential stay. A lot of families don't understand that. I did a webinar last week, and one of the parents on there, came away from that saying, oh, okay, that makes all the sense in the world. Now I understand the importance of that continuing care following treatment. And again, they were their loved one is in a good treatment program, and there hadn't been as much family involvement as I probably would have liked to have seen. But because I was working with those parents in terms of helping them understand what's going on in treatment, they were able to bridge that gap somewhat. There's going to be a different understanding of their willingness to support their loved one continuing in the outpatient care following his residential stay. So I just want to stress that, how important it is that families recognize. I have a phrase that I use: the untapped potential the family represents in improving treatment outcomes. And that's a way of saying, if there was a pie chart that we identified as things that contribute to poor treatment outcomes, or opposite, things that can contribute to improving treatment outcomes. That's a better way to say this, right? Stick to the positive. While there's no guarantee for successful recovery, and it does depend on the client in there. We can't force anybody into recovery, and it is a difficult, complex undertaking treating a substance use disorder. I would say that a large piece of that pie would be represented by how much of an impact the family can have. And there's things that the family can do that's totally within your own control, not having to depend on the treatment center to wait for the next family education lecture or the next family therapy session. There's things that the family can be doing on your own to be learning as much as you possibly can about how treatment works and understanding what it means to be diagnosed with a substance use disorder. And you knowing that can make a huge difference in the type of support that you provide for your loved one, and that can make a huge difference in their treatment outcomes. I will put a link to that blog that I mentioned. It's called The Top 10 Things Families Can Do to Avoid Common Treatment Pitfalls. And that's where I created my little post and a diagram about what does Led Zeppelin have in common with drug rehab: communication breakdown. And we want to bridge the gaps between the client, the family, and the treatment team. I'll put a link to that blog post. I hope you take a chance to read through that. Hope you find that helpful. I'll see you next time. Bye.